All right. Hi, everyone. I'm sorry that the last link didn't work up. Apologies for the same, for your precious 15 minutes of your life. And now let us start the session. So, again, the rule is the same that first I will check whether it's working or not, and then I'll give you 10 questions. So, I'm going to check first whether the current link is working or not. Okay, yeah, fine, it's working. So the rule is the same that there are 10 questions, and I will give you some time to solve the questions as per the questions. Some I'll give you more time, some I'll give you less time. And then at the end of the 10th question, no need to answer, okay? At the end of the 10th question, I'll discuss all the 10 questions. Then you can write or whatever you want, and then it will be uploaded as well. All right, so I hope, yes, I'm visible now. I know. Let us start. I'm starting the quiz now. Your time starts now. This is the first question. I'll not speak anything. I'll give a specific number of seconds and minutes, whatever I feel is should be done, should be required for this question. You don't need to write anything. Just keep note of which answer you have made. Okay, second question. Third question. Fourth, coming up. Now, if you know this, you know this. If you don't know, you don't know. That's why I'm going up to question number 5. I'll give time for this. Okay. Sixth. All right. Seventh coming up. Think a little bit for this. All right. Question number 8 coming up. Okay. Ninth. I'll give you time for this. It's a big question. Nikhil, everything is visible. I can also see. Okay. And the 10th question will be shown during the discussion. Okay. The 10th question is this. There is no question because I will ask a question when I will discuss the 10th question. So these are the 10 questions. Now let us discuss one by one what are the correct answers for this. So the first question is an anatomy of the lens question. The lens is derived from surface ectoderm. You should know this. Other things from surface ectoderm, you should know the skin of the eyelids. Only the skin of the eyelids, lens, lacrimal gland, and appendages of the eyelids, like hair follicle, glands, and E epithelium of cornea conjunctiva. So SLE you can remember as a till in class. And yes, it's a part of anterior segment. From cornea to the posterior part of lens is the anterior segment. Lens is a part. No, that is the answer. Correct answer over here. Zonules are not attached at the poles. Zonules are attached at the equator of the lens. The poles are anterior and posterior pole, and equator is 360-degree. The zonules are attached over there. And yes, the lens does not have posterior epithelium because in embryonic life, the posterior epithelium forms the lens fibers. So that's the first question. C. Now, this is a factual question. Lens made up of 66% water, 34% proteins. Of the 34% proteins, we have crystallins and albuminoids. Crystallins are soluble proteins. They are responsible for transparency. Alpha is the largest, that's the answer. Beta is the most common. And gamma is associated with the gene of congenital cataract, that is the CRY gene. While in cataract, the albuminoids are more, the crystallins are less. So that's the answer. That's a fact. Alpha are the largest in the lens. Now, this is the slit lamp picture. The patient is not, there's not a lateral view. This is, the patient is looking straight. And this is the slit picture. This is at the level of cornea. So A is cornea. This is the slit picture at the level of cornea. The pupil is dilated. The brown is iris, and this is the lens. This is the B is the anterior part of the lens. C is the center of the lens. B is the posterior part of the lens. The highest refractive index cornea is 1.37. The lens is 1.4 something, and the highest is in the center of the lens. So C is the answer over here. Good answers, everyone. And that is how you know in slit line picture where is the problem in the lens or the cornea. By only by slit picture you can tell this. So this is actually nuclear sclerosis going on over here. Now Purkinje or Purkinje images are 4 in a normal person, 2 by cornea, 2 by lens. 1 is because of anterior cornea, 2 from posterior cornea, 3 is from the anterior lens, and 4 is from the posterior lens. And in aphakia, there is only 2 because there is no lens. In pseudophakia means there is an intraocular lens placed. So 2 from cornea, 2 from the anterior and posterior IOL surface. What are the clinical investigations based on this? Or one more factual point, the posterior lens is like a concave, right? It's not looking at the other three. So posterior surface gives a real inverted image inside the eye, while 1, 2, 3 gives a virtual erect image. So cornea thickness is measured by 1 and 2. Cornea curvature, cornea surface is measured by 1. In specular microscopy, you see the endothelium. That is by specular microscopy based on Purkinje number 2. 3 and 4 will give you lens thickness. Who can tell me? Anterior segment is because of anterior segment is distance between 1 and 4, and anterior chamber depth is between 2 and 3, because chamber means from posterior surface of cornea to iris lens diaphragm. So 3 is the answer of this question. Now, if you are thinking a lot that a child surgery in a child is lens aspiration, capsular access, antivitrectomy plus IOL, you are absolutely correct. But this is not the cataract which causes decreased vision. This is a blue dot cataract. In blue dot cataract, you don't do anything. Blue dot cataract is the most common cause of cataract and does not cause decrease. I also have it. In my right eye, I have a blue dot cataract. Don't look at me. Yes, घुस के नहीं देख लोगे आप कि मेरे आंख में ब्लू डॉट कैटरेक्ट है. If you want to see my blue dot cataract, get a slit lamp, get me also, and then you can see the right lens has blue dot cataract, but no vision loss, no treatment required. Even in sutural cataract, that is also a Y-shaped cataract, no treatment is required. Now, this is the diffuse picture. In a diffuse picture, this brown is the iris. Cornea, you can't know the level of the cornea because it is a diffuse picture. A is the phakic area, means it is a lens. B is the aphakic area. So the lens has gone up from its patellar fossa. It is going up. Inside the patellar fossa, it is superior subluxation of the lens, which can be seen in Marfan's. Yes. You will say, sir, Marfan's have supratemporal subluxation. Yes, most common. But Marfan's can have any subluxation. It will cause astigmatism, yes, but not lenticular astigmatism. It will not cause corneal astigmatism. It will cause lenticular astigmatism, and that's why the patient will have decreased vision. It can have uniocular diplopia, and you have to, if the treatment is very advanced point, I'm saying treatment of subluxation. If there is a cataract or if there is a significant vision loss, then you have to do cataract surgery, and you have to stabilize the capsule by capsular tension rings. But generally, that is not asked in the exam. So D is the answer over here. Good answers, Devanshi. Now I gave time for this. Post-cataract surgery, complications are very, very important. Endophthalmitis is infection, inflammation of inner layers of the eyeball, plus exudates in the vitreous and the aqueous. Means outer fibrous cornea sclera is not involved. Now if the visual acuity is less and not responding to intravitreal antibiotic, why will you give intravitreal antibiotic again? See, there was a study in which, even if you don't do the study, if the visual acuity is less than hand movements, then you have to go with vitrectomy, pars plana vitrectomy. And if the vision is more than hand movements, then you try intravitreal antibiotic first, and then if it is not resolved, then pars plana vitrectomy. Here I have given already both things. It is not responding to intravitreal antibiotic. The next option is pars plana vitrectomy. Now, those people who have, this is evisceration, okay? Those people who have marked evisceration, thinking that it has gone into panophthalmitis. There is nothing written over here. There is panophthalmitis. If cornea sclera are involved, for example, it's written that cornea is cloudy, cornea infiltrates, or sclera is involved, sclera has necrosis, means panophthalmitis is there, then the answer is still systemic antibiotics. If it is not resolved, then painful blind eye becomes, then it is evisceration. Systemic antibiotics have no role in endophthalmitis. So that's the answer. Now, eighth is a repeat question. Actually, it's a diffuse picture. Anything white in the lens is cataract, because that's the cataract is known as safed motia in Hindi. Motia, safed motia, not kala. Kala is glaucoma. Nothing kala in that, because that's an irreversible vision loss. Here it is white in the cataract. Now, what happens? You see this. This is your iris shadow. This iris shadow is seen in immature senile cataract. Now, from age, you can rule out zonular cataract and snowflake cataract. Now, snowflake cataract is seen in type 1 diabetes mellitus. That is in young age. Zonular seen in congenital cataract. That is not in 65 years. So, answer has to be between immature and Morgagnian. Morgagnian looks like a small fibrous lens, and the nucleus settled down at the bottom, looking like a Morgagnian cataract sometimes. But that is not here in the picture. It's a diffuse white cataract, and there's an iris shadow over here. Even if you don't know there is an iris shadow, you have to rule out the other options to know that there is an immature senile cataract, and phacoemulsification has to be done for this patient. Good answer, Garima. Now, I gave a lot of time for this question. Let us see who got this question correct. The 50-year-old patient, 50-year-old patient. What can you rule out by 50-year-old patient over here? Directly, you rule out keratoconus. If you're marking keratoconus, then it's ruled out, because keratoconus is a disease of young. Now, he's wearing -2 diopter glasses in both eyes. Noticed blurry vision in the right eye recently. Went to the doctor. To his surprise, the doctor told that the power of right has increased from -2 to -5. Means myopia has increased. Left is still the same. But still the best corrected vision is 6/6. Now, doctor prescription is not correct. Cannot be the question answer in your medical field. Nobody will give you that. So that's absolutely wrong. There has to be something going on. What is going on? In posterior subcapsular cataract, the vision cannot be 6/6. That is ruled out. And it is increasing. Myopia is increasing, means there is a center of the lens having dents. So light will come and focus in front of the retina, increasing the myopia of the person from -2 to -5. That is the answer, nucleus process. And he will have good near vision as well. That is a second sight phenomena patient. Keratoconus is ruled out. I know many people have marked keratoconus because Again, keratoconus, this can happen. -2 to -5 can happen. And best corrected vision can be 6/6. But 50-year-old cannot be keratoconus. And now the 10th question. The question is, which step of cataract surgery is being done over here? You can write down or you can think in your mind. I'll tell you the answer. This is a step in which a dye is also used, trypan blue dye, to stain the anterior capsule. The answer is anterior capsulorhexis. Yeah, good answers, everyone. And that is the 10th question. Answer: you make a center circular in the anterior capsule. That is anterior capsulorhexis. That's the 10 questions. Let me know how many questions have we done correct. Those who are will see it live, they can also let me know in the group. All right, good answers. Chanvi 8, Jyoti 10. Very good. Excellent. Good, Khushbu. Yeah, looks like a flap correction, but in flap, that is in the cornea, not in the lens, not in the anterior capsule. Good, Nayantara. Unnati, good. 8 above is good. All right. Thank you very much. I will update you for the next live session. Sorry, there was a trouble initially for the link. Sorry about that. Let's see next time. The next will be the same sequence I followed for the season 1. This is season 2. The same sequence I'll follow for this also. You can go and see the previous subject-wise, topic-wise questions. I'll update in the group as well. All right. Best wishes. I'm ending the link now.